To begin with, like a couple of months ago, I was sitting with Schengen and with Teunis, and we were discussing this panel. And Schengen asked me, say, okay, Martin, can you talk a little bit about UNH? Why is UNH a very successful program? And can we learn some lessons from it? And it's, of course, nice to talk about UNH, although, I feel as a nutritionist I should talk about nutrition. So this time I will not talk about nutrition. But still, my career started about 34 years ago here in Thailand. And I was working on vitamin A deficiency, and it was a very innovative strategy using capsules to reduce mortality as well as xerophthalmia. But from the beginning, we had an incredible fight between two different groups. One is saying, no, we need home gardening, and another group saying, no, we need capsules. And that actually, exactly what Professor Pigali was saying, is that when you have innovative approaches and you start to fight against that, but in fact use them together, is very critical. And I think that's the basis for what happened in UNH. So they were, starting when I was 10 years ago, representing WFP in the joint program. It was a quite unique environment. We had not really the treatment yet. We didn't know what to do. We had incomplete information. But what we had was 11 agencies, UN agencies working together. We had people living with HIV, part of the joint program. We had NGOs. We had donors. We had the countries. So you had the industry was part of it. So everyone was part, in fact, of this joint program, and in fact there was no evidence yet. When you say, oh, we need all the evidence, no, there was evidence that certain components were critical for tackling the problem of HIV/AIDS. And I think what they did very well, instead of saying, okay, we have so much time when we work together and having meetings, let's have a division of labor and work, again, with incomplete information. So people who are working on legislation, people who are working on the gay rights, people who are working on treatment, all these different elements were, in fact, separate. So people didn't have to work together on meetings, but working on issues where their own strength was. At the same time, of course, you had the joint program with incredible leadership of Peter Piot, who, in fact, did a virtual analysis of all these different elements. So progress was made in all these different fields, almost independent of working together. But because of the virtual analysis, what happened at UNH level, things moved on and became better. And I think that is something which is very critical, because we always talk about working together and having enough evidence and building evidence, but in fact you can do a lot without even incomplete evidence, which is very much against scientists. No, we don't like that. We like to have everything ready before we start to move forward. But this didn't happen. And so if you look at now, after 10 years, almost more than 60% people are on treatment. We do testing and treatment. We changed completely, the starting point of treatment. CD4s were before, we only treated when people were completely almost dying. Now we treat far from, in fact, when the disease started. So I think the lesson learned for the nutrition and for the food system work is that let's come up with a division of labor, but have a joint program almost, like virtual, that we do virtual analysis, like, for example, the Global Nutrition Report, where everything comes together, but we don't always have to work completely together to actually make a huge difference in this field.